Well, thanks everyone. So, there we go. So I wanted to start off today by asking you a question. In your practice, how many of your patients have dry eye disease? How often do you encounter dry eye in your practice? So according to TFOS DEWS 2, between 5 to 50% of people have signs and symptoms of dry eye disease. And depending on the population that you look at, up to 75% of people have dry eye signs. So why do we get this difference in the prevalence of dry eye disease? So comparing one study to another, it often depends on different genetics, the population that you're looking at, some of the environmental factors, patients' lifestyles vary from one country to another. It could even be due to misdiagnosis or self-diagnosis of other conditions. Maybe someone's suffered itchy eyes for a long period of time and they've always thought it was due to allergies. And also depends on how you define dry eye disease, what cluster of signs, what symptom score you assign, and also the severity or cutoff that you give it as well. So looking at dry eye disease in Australia, we've got a study in 1998 and 962 people were surveyed and they found that 7.4% of people had more than 2 signs of dry eye disease. And then we go forward 5 years to the Chia study, the Blue Mountains eye study. And they found that 57.5% of people had at least one dry eye symptom. So looking at the prevalence of dry eye disease on Google, so we can look at, because everyone's using Dr. Google these days, we've got a whole bunch of data about when people type in a search for dry eyes, dry eye treatment, what is dry eyes. Google can cluster all of those topics together and it helps us to really see what are people typing in and what's happening on when they're not, what's happening to patients when they're not in our offices. And we can see, based on a relative score between 0 and 100, where 100 is the peak, from 2009 to current, dry eye disease has increased to 300% of what it was in 2009. Optometry Australia has done a great job with their Vision Index report in 2020. They surveyed 1,000 people and they looked at a whole range of different conditions, but dry eye disease was one of theirs. And they found that 77% of people will experience one dry eye symptom in their lifetime. Imagine 77% of your patients having some form of symptoms of dry eye disease. Only 26% of people had sought the care of an optometrist about it. So maybe other people are searching around for options, putting up with their eyes, just thinking it's due to, oh, I'm just feeling tired or I'm just feeling stressed. And 36% of people said that they found it difficult to concentrate at work. So let's jump back in time to 2007. I was a new graduate optometrist. I was jumping into clinical practice for the first time. I wondered whether I'd ever be able to go from 3-hour appointments down to 30-minute appointments. It was playing on my mind, could I ever achieve this? But I was, with these patients with dry eyes, they'd often be on some sort of really watery eye drop. And I'd try to find a better option for them. I'd try and look at something like a Cystane gel or a Gentile gel, just something that was a bit more, bit thicker to try and give them lasting relief. But by the time they came back to see me, they said, yeah, it helped a little bit, but it didn't last. And it left me thinking, what more can we do for the patients? And of course, there's baby shampoo as well. I'd often surprise them and say, have you tried baby shampoo to wash your eyelids with? And the puzzled look on their face was quite interesting. So let's take a study that was published in 2007. It was an ARVO abstract. And they took 75 participants in this study, and they had moderate and severe dry eye disease. 39% of people used artificial tears, gels and ointments more than 10 times a day. 69% of people had punctal plugs. And the conclusion of the study was that dry eye disease has a significant impact on patients' quality of life. 10 times a day doing anything is enough to be draining and exhausting. And that current palliative treatments are not sufficient to solve this dry eye matrix. And then we have DEWS 1 that was published in 2007. And this is the first time that a real diagnosis had been put together by a panel of experts. And if I'd known about this, if I had looked more into dry eyes at the time, I could have been able to treat dry eye disease better. And we can see a stepwise approach, just like Dr. TFOS has talked about, talking about diet, educating patients, and going through eliminating systemic medications, and then jumping more into the disease process. And in the management report, one of the summaries was that replacing specific tear factors will have an essential role in maintaining ocular surface homeostasis. That's what they were looking forward to try and replacing some of these individual factors. And inhibiting key inflammatory mediators was going to be a real important priority for going forwards. So here's a survey of Australian practitioners. 144 practitioners were surveyed, and you can see with the graph there's different colours. So the mild dry eye is in the lighter colour, getting into the grey, and then the black for severe. And you can see that the two most common treatments were lubricating eye drops, non-preserved, and eyelid hygiene. And as we look along the bottom of the graph there, you can see that there's no, it takes a long time before we start to look for inflammation in the eyes. And there was a paper published in 2020 talking about the different, in the world, some of the different dry eye treatments, and Australia was one of those countries surveyed. And our top two treatments were still artificial tears, non-preserved, and lid hygiene. TFOS released a new paper published last year. They surveyed 1,139 practitioners from around the world. And there was 53 from New Zealand and 58 from Australia. And so what we're doing well with dry eyes, we're compared to Australasia, compared to Europe and other continents, we're doing well with advice. We're talking about hydration, healthy eating, office environment, artificial tears, lipid-containing drops, ointments, lid wipes, moisture chamber goggles, warm compresses, and therapeutic meibomian gland expression. Meibomian gland expression was one of the first treatments that I started doing for dry eye disease. getting into the blepharospasm and expression, it really started to help patients. So in a summary, what we're behind on is these anti-inflammatory treatments. We're not looking for inflammation in the eyes. We're not trying to help stop that mild dry eyes progressing to moderate to severe dry eyes. Whether that's topical steroids, cyclosporin, levetiragrass, or whether we're going to even things to autologous serum, we're lagging behind on some of these anti-inflammatory treatments. And so we need to go looking for signs of inflammation for our patients. Like Dr. Torres mentioned, talking about lid margin telangiectasia, looking for lid margin telangiectasia in our patients. Next time you're in clinic, pick a day and see how many of your patients have signs of lid margin telangiectasia. I think you might find that you're surprised how many don't have lid margin telangiectasia. Conjunctival hyperemia, whether that's bulbar or palpebral, you can see these little fine vessels on good magnification. It almost looks a little bit like a neurovascularization, but you can tell that there's definite blood vessel changes. There's papillae and limbal injection as well. Punctal stenosis with that longer term inflammation in the eyes, and corneal staining. So dry eyes is a vicious cycle of inflammation, and it starts off with the tear film instability. We know that there's over 1,500 components to the normal tear film. It's a lot more than just a lack of water, like Dr. Torres mentioned. There's this amazing complex matrix of lipids, mucins, a whole bunch of different things that go together to put the tear film together. And so when this is out of balance, then we get into the tear hyperosmolarity, where the tears become more salty, which aggravates the epithelium. And then you get these pro-inflammatory mediators that are released. And you get goblet cell loss and epithelial damage, and then that starts to further destabilise the tear film. So have a think about how many of your patients suffer from dry eye disease. As part of your routine workup, try and go looking for signs of dry eye disease, and I think you'll find that you have happier patients from it. So, thank you.